Hello, I'm Dr. Greg Jossart, and I have prepared and narrated this brief tutorial for you. I think you will find it informative when considering this surgery. Weight loss surgery is called metabolic and bariatric surgery because the weight loss that occurs treats more than just the obesity. The term bariatric is related to pressure. Weight loss reduces pressure on the joints and lungs and other organ systems. This allows for greater mobility, improved breathing, and less joint pain. The metabolic part of surgery leads to improvement or a cure of diabetes, high cholesterol, and high blood pressure. Obesity is also a state of inflammation that improves with weight loss. This reduces the risk of 13 obesity-associated cancers and the risk of fatty liver becoming cirrhosis. You should consider weight loss surgery if you have not been able to lose weight with diet and exercise, and you have medical problems related to your weight such as diabetes, high blood pressure, sleep apnea, and numerous other problems. Generally, you should have to lose more than 50 pounds or have a body mass index over 35 kilograms per meter squared. You can check your body mass index on any BMI calculator on the internet. Obesity occurs due to consuming more calories than burned off during your lifetime. You may have a genetic risk for obesity as well. You may have been great at diet and exercise. You may have lost weight and kept it off for years. The main reason it is so difficult to lose weight and maintain the weight loss is you still have a normal-sized stomach and digestive system that is intact. That makes it much more easier to consume calories than it is to exercise them off. Surgery works by reducing your portion size and total calories consumed, and in bypass operations, calories absorbed. Once you start losing weight, you can become more active and start exercising again to help metabolize or burn off excess fat. Restriction refers to reducing the stomach size so you can only consume 1 to 2 ounce portions of solid food. Malabsorption reduces the digestion and absorption of some calories you eat by creating 2 separate channels of intestines. You should not choose an operation because you think that one has a quicker recovery or is less painful. They all are done through the laparoscopic method of small incisions and have similar recoveries and outcomes. The sleeve gastrectomy has become the most common operation at 61% of all procedures, with an increase of 451% since 2011. This is because the 5-year outcome studies prove a good weight loss and a good safety profile. This slide is just a quick reminder that any laparoscopic procedure may still require a larger incision. This is rare, but is usually still left on all consent forms so patients are aware that it may be necessary if there is a bleeding problem or adhesions or other technical problems. The next series of slides will discuss each operation currently approved by insurance companies. The gastric band helps you lose weight by creating a blockage point at the top of the stomach. It can be tightened or loosened. It has dropped to less than 2% of operations because of device-related problems, and most patients choose a sleeve gastrectomy as a more effective operation. The sleeve gastrectomy operation involves removing most of the left side of the stomach, known as the greater curvature, and leaving behind the right side of the stomach that still has the nerves that sense stretch, pressure, and fullness. There is some evidence that there is a reduction in hunger hormones and therefore less hunger. There is no foreign body and no stapling of the intestines, so this is often chosen for a better safety profile than other operations. It is a good operation for those who need to lose 75 to 150 pounds. It is very difficult to lose more than that with any operation. The gastric bypass has both a small stomach pouch and some stapling or bypass of the intestines. It may be slightly better than a sleeve gastrectomy for weight loss, reflux symptoms, and diabetes, but the bypass has several long-term problems that many patients hope to avoid. These include ulcers, blockages, dumping, diarrhea, and vitamin deficiencies. The duodenal switch is rarely performed due to it being technically difficult, and the amount of malabsorption can lead to a higher rate of problems with diarrhea and vitamin deficiencies. It is less than 1% of all operations. You should be aware that you may require additional procedures at the time of weight loss surgery, and the following slides review these procedures. If you have already had your gallbladder removed, you will only have a few minor adhesions that only extend the operation by 5 minutes. If you still have your gallbladder and you have an ultrasound prior to surgery and it confirms gallstones, your gallbladder should be removed at the time of weight loss surgery. This will avoid the need for emergency gallbladder surgery in the months and years afterwards. If you do not have stones at the time of weight loss surgery, you do not need to have your gallbladder removed. You may still form stones in the future and require surgery many years later. You may already know you have a hiatal hernia from symptoms of heartburn or a test that may have diagnosed it. You may not know you have it, but it may be detected during surgery and repaired. 40% of patients will have a hiatal hernia repaired at the same time as weight loss surgery. Adhesions or scar tissue are present either from prior surgery, infection, or trauma such as a car accident. Minor adhesions may take only a few minutes to divide. Patients with multiple prior abdominal operations in the past may have a lot of adhesions that could take an extra hour to divide. All patients with obesity have fatty liver, and a photograph of your liver can be completed at the time of surgery. A small piece of liver can also be taken with a special biopsy needle, and the severity of your fatty liver can be detected by looking at it under a microscope. You will receive a report for this. All fatty liver improves with weight loss. Hernias at your belly button or nearby can be repaired at the time of surgery or later when you've lost weight and the stress on the hernia is less. Insurance approvals for weight loss surgery are often very complex and confusing. The insurance companies will not authorize you until they receive my note, the dietary notes, and the psychology notes. Some of you will also need to spend 3 to 6 months doing additional monthly weight management appointments based on your insurance company's policy requirements. You must always get in better shape for surgery. Losing weight and increasing mobility prior to surgery is what makes weight loss surgery so safe. You must have good control of your diabetes and high blood pressure by the day of surgery. You will also receive a checklist of items on page 13 through 18 in our goal weight guide to go through in the weeks and months prior to surgery to be sure you do all the proper testing. All patients will need blood tests within 30 days of surgery and a 12-lead EKG within the last 12 months. If you are over age 50, you may need some additional tests, and that will be reviewed at the time of the office visit and is also detailed on page 13 through 18 in the goal weight guide. On the day of surgery, you usually arrive about 2 hours before the planned start time, and the operation will take 1 to 2 hours, and you will be in the recovery room for a few hours. Over half of patients leave the next day. Some patients need to stay 2 nights. We have you up and walking several hours after surgery, and you start drinking liquids the morning after surgery. You remain on a liquid diet for the first 14 days. We see you in the office at 1 week after surgery. Most patients return to work in 1 to 2 weeks. On day 15, you start trialing very soft foods such as yogurt, and on day 22, you start soft meats and produce such as fruits and vegetables. The goal is to consume up to 600 calories per day in portions that are only 1 to 2 ounces. This will allow for a weight loss of several pounds per week for several months. You must start increasing your activity and exercise as soon as you can tolerate. Pain is so mild that most patients can exercise quite well 2 weeks after surgery. The number one problem in the first month is hydration, so be sure to focus on drinking liquids. After day 31, you should maintain a diet of up to 600 calories per day. This induces a mild state of starvation that will allow you to lose the excess fat at a rate of several pounds per week. Always start with proteins and limit portions to less than 2 ounces, as eating more may result in vomiting and belching. Avoid liquid calories, as even the smallest type of stomach pouch can't stop liquids. Avoid starch such as bread, pasta, and rice, as that will slow weight loss. Once you lose all your excess weight, you may eat some starch again. Avoid alcohol and carbonation, as they will slow your weight loss. The remaining slides offer some key tips for long-term success. Calories must be limited to 600 calories per day until goal weight. Those who exercise more may need to go up to 800 per day. Portions should be limited to 1 to 2 ounces so you don't stretch your pouch. Start with protein to preserve the muscle mass and keep carbs low to enhance the breakdown of fat. Carbs should be produce such as fruits and vegetables, not food from a box or a bag. Exercise must include cardio to burn off excess fat and strength training to preserve muscle mass. Start within a week or 2 of surgery and gradually increase every week. Aim for 10,000 steps per day or 60 minutes of vigorous physical activity at least 3 days per week. You may be surprised at what you can do. One patient can run a 100-kilometer marathon 5 years after a sleeve gastrectomy. Tracking their weekly result is underutilized and probably the reason that some patients won't lose enough weight. You simply can't let the operation do the work for you. You must monitor yourself. You can't do much to change your daily weight, but week after week, you can prove to yourself that you are achieving the goals. If you do not lose enough in any given week, you can exercise more and eat less the following week to achieve the weekly goal. In summary, achieving and maintaining your goal weight can't be done with surgery alone. Only those with a determined attitude who eat correctly and exercise daily will achieve a healthy weight. Thanks for taking the time to watch this video, and I hope you found it helpful. Feel free to contact my office directly for more information.